Today, we are having with us Dr. M. Prakash Kumar, former Joint Director, Medical Education as our faculty. He is currently Professor in Anuradha Homeopathic Medical College, Bangalore. He is the guest faculty in Yenapoya Homeopathic Medical College, Bangalore. He is a Joint Director, Medical Education Department of Ayush, Professor, PGK Materia Medica for 13 years of administration. And he is the member, ex-academic council and faculty member, RGUHS, Bangalore. He was the medical officer of Government of Karnataka from 1986 to 1996 for 10 years. And he was a Joint Director, Medical Education Department of Ayush from 2019 to 2020. He is the examiner for Bangalore University, Rajiv Gandhi University of Health Sciences, Vinayaka Mission Homeopathic Medical College, examiner for Goa University. So we are with us a very eminent personality, and today we are going to have a discussion on the use of rare remedies in homeopathic practice. I welcome you, doctors, students, and homeopathic lovers for this session. I welcome Dr. Prakash Rao for the session.
Thank you. Thank you very much, sir. I, Dr. M. Prakash Kumar from Bangalore. I first congratulate all the office bearers of IFPH who are regularly conducting the continuous medical education since 3 years. It is really the big challenge you might have taken. The first time I have seen in my life, the organization is running a continuous medical education for past 3 years. It will go as it go on actually. And I am very happy that the members I have seen from all over India as well as from the different parts of the country. So today, I would like to have a topic, use of rare remedies in homeopathic practice. So dear respected doctors, I am really support the people who practice with single medicine. I really appreciate it. After taking the case for taking more than 15-20 symptoms, doing the repertorization, finally coming to a single drug, depending upon the susceptibility, depending upon the constitution, we give a single medicine. That also I respect it. But after doing my practice for many years, some of the case taking where actually we do, we may have some difficulties. And that actually the reason actually I started using the rare remedies. What is rare remedy? Actually, there is no question of rare remedy. Everything is there in homeopathic materia medica only. Only thing actually, if we do repertorization of 15 symptoms of a case, we never see these medicines in our repertorization list of medicines. So as homeopathic doctors, we have to do the justice to the patient. That means justice is by giving the relief or giving the cure. See, if I ask my patient, because I have practiced as a medical officer in rural areas, if I ask the patient more than 4 questions, he will ask me, why you are asking unnecessary so many questions for me? It is not right. See, for a female, she comes for a symptom of headache. If I ask her menstrual symptoms, she will get annoyed actually, and she will keep on asking, what is the purpose of asking me the symptoms of menstrual symptoms? This is what the reasons why I started using some of the medicines. Before that, it has all happened to me. And also, if you go to the disease per se, the person is suffering from a particular condition for more than 15 years. If I ask, what is the beginning of your disease? An educated class of people may answer properly. I had an injury. I had some failure in the love. That is why I'm able to, the problems are started from the day. But majority of the people, especially people with, say actually, there's no proper education for them, they find it very difficult. They can explain only the present symptoms. There actually, we find it very difficult actually. So whether to treat a present case or to treat an old case, what he was suffering, he may not be doing properly. This is one reason actually. I was practicing as a medical officer in a deep Karnataka village where there was a scarcity of water. Because of the scarcity of the water, people never used to take bath for weeks together. No doubt actually people are good. Because they don't have water to take bath, even the clothes were not washed properly, because there is no water to take bath. Even for drinking water, they are finding it very difficult. And some majority, even the people with the affluent society people also, if you see the way they present in the hospital, they look, majority of my patients used to look like sulfur. And I am not in a position to prescribe the sulfur. That is not the medicine for him. So what has happened actually was practiced even in the oldest places in Karnataka, like Kodagu district, as a medical officer, where there was a continuous rain for 3 months and the weather was very damp weather. If I give some of the regular acute medicines and there was no proper response for it, then I have searched some of the specificity of those drugs and I started prescribing, and I am getting the results also. Now, any patient coming to the clinic with a chronic history, in the chronic history, acute totality is considered. So first we have to give some relief for the patient. He has got headache for the past 15 years and is on an allopathic medication. If I come to a homeopathic doctor, I have to give some relief, at least within 3 days, 4 days, some relief I'm saying, not what a cure. For the some relief, the medicine on the totality of the symptoms may not help to the patient, That is why, so I started giving some of the medicines which I have searched in the homeopathic Materia Medica, which has given me a good results, and it has helped me in practicing further with the particular patient. And it is very honestly say, and don't feel bad for it actually, majority of the homeopathic doctors comes from an average percentage, but these average people only has done a lot of research, that also I'll accept. But because I have traveled from Kanyakumari to Jammu Kashmir and from all parts of India as a inspector in the Central Council of Homeopathy, and I have seen the different types of practice in different states and who are successful. And I have seen some of the doctors giving a simple 0/30 also successful. And I have seen in some of the states they prescribe 4, 5 polypharmacy also, they are also successful. Everybody with 100 patients I have seen. Some of the doctors will see every day 100 patients. Imagine if he is seeing 100 patients, what is the time he can spend with the patient? That also plays a very important role. He has to give the relief in the time which is available in the. So my intention actually, let me give the relief in the beginning, followed by the chronic problem you can treat with a single medicine on the totality of the symptoms. And also in how many the books what we study, except Hahnemann Materia Medica Pura, all the Materia Medicas are written by some of the experience or by copying of some other books. That I think so everybody accept this. With this actually even Hahnemann medicine of Pura, Materia Medica of Pura, he will not mention the duration of action of the medicine. Duration of the action of medicine is seen in Boric Materia Medica, and some of the Materia Medicas presently we are reading it. But Hahnemann has thought actually till the medicine is acting and till the patient is feeling better, that medicine has got the duration of action. That also will accept it actually. But I really honestly say, for an average knowledgeable doctor with homeopathy, he find difficulty. If you just go for a totality of the symptoms, we have to go for the acute totality, we have to go for the chronic totality, we have to go for sector totality, and we have to go for the fixed general totality. Honestly say actually, seen in my 25 years of teaching experience, many students were finding it very difficult, especially students coming from the rural background. And the average students in a government college, I'm saying, not in private college, they were finding it very difficult to take the case and come to the simillimum. But they were often asking me the same question, actually, sir, we are finding it very difficult to give some relief for the patient with the total of the symptom or giving a single drug. So I have, with this practice actually, with this my experience actually, I have encouraged good number of students from the rural background and even in the urban background also. They have started beginning these medicines and they are successful, followed by they are giving the right medicine of the chronic totality and they are successful in their practice. That is my intention. So, and I have come to know actually even many a times actually if a married girl coming to the clinic with a husband or with the in-laws, if I ask her past history, she will never reveal the past history. Whatever may be the past history it is, she will say, I am totally fine till today. Only after the marriage, the problems are started. This was actually, I was experienced for, till today I'm experiencing not, I'm saying for the 35 years back, I'm telling, till today in my clinic also, I find difficulty to take a complete case because patients may not give the proper answer, which will have once again the difficulty in prescribing the right medicine. But the medicines which I am discussing now, the simple CORYZA, which I was find it very difficulty when I was practicing in Kodagudi state, where so much of dampness were there for 3 months. If I give drugs like Sabadilla, Allium-Cepa, EPHRESIA, these drugs, when I don't get the relief, I started giving a medicine called Justicia Hadathoda Basaka. It is prepared from Indian shrub Singi. This is a severe CORYZA with lateral inflammation. So based on that, the single symptom of the severe CORYZA with the lateral inflammation in the lower potency, after giving, patient was finding relief within 3 days. So other medicine which was prescribing for common cold is Squilla meritema, the sea onion it is, where actually CORYZA for more than 5-6 days, not better by taking any of the medicine, is a fluent CORYZA. If you see the nostrils feel very sore, no doubt actually Allium-Cepa is a suitable medicine. And also the patient has got cough with a stitching pain. So that time I was given Squilla meritema in lower potencies. The patient felt very better, and I am practicing since many years and it is successful also. One more actually for CORYZA, I use the medicine called Saponoria. It's a soap root. It is almost specific treatment in treating the CORYZA associated with headache. 1 or 2 associated symptoms also it take, but Saponoria will act like a specific medicine in treating the common cold. So camphor, I have come to know actually majority of the doctors will not use camphor for CORYZA. They give camphor only for is a medicine to antidote the side effects of the drugs. Number 2, it is a medicine generally we use in severe diarrhea with lack of vitality and all. But in my practice, actually use camphor also when there's a fluent CORYZA due to sudden change of weather. No doubt actually Dulcamara is the medicine. When Dulcamara doesn't help the patient, I use camphor as a medicine. So other medicine is Agraphis nutans. No doubt actually Agraphis nutan is once again is a medicine for catarrhal inflammation. It's also a medicine for CORYZA. Only thing actually if you see the nostril, we see a adenine in the nostrils. It also helps in dissolving the adenine and also helps in decreasing the common cold. No doubt actually when the adenites are there in the nostrils, lemna minor is one of the medicine which you think of. But in my practice, actually, Agraphis nutans has given the best results. Other drug which I use, only thing I use one associated symptom intake, Hedera helix. So this is a medicine actually where there is a continuous CORYZA where discharge will be there from the nose like a tap of water, dribbling of mucus from the nose. It is a medicine, a specific medicine for rhinorrhea, allergic rhinitis, and also it is a medicine used for cerebrospinal rhinorrhea. So hydrocephalus is also medicine prepared from vegetable kingdom. So AVR, I have seen good number of my friends and doctors will not use this medicine AVR. It is a nosode prepared from bird. Generally we use tuberculum in pediatrics. When a patient coming to our clinic with often cold, we give an intercurrent medicine as tuberculum. If the patient is hot, we may give medorinum as a medicine. If any psychotic family is there, we give medicine as a thuja. But I have tried AVR, a nosode prepared from the bird, tuberculum nosode. This is the one actually a patient with a child with often CORYZA and cough with a tuberculosis in children. AVR as intercurrent remedicine helped the patient in and also following medicines really helped them. Headache is one of the main problem actually we see in the clinics today. Headache, actually there are many causes are there. There's a neurological headache, there's a congested headache, and also headache has got 101 causes are there. Any patient coming to the clinic with a chronic history of more than 10 years, where patient is not better even after taking allopathic medicine, I give Usnea barbeta. It's a medicine for congestive headache where Clonine is also has got a similar symptom, but Usnea barbeta has given the relief within 2 days. The patient feels comfortable and coming to the clinic. Afterwards, we can. And also one more medicine, Nicolamet. Nicolamet, it is written in the book. It is the headache. It is a periodical headache, but sick headache we call it as. Patient often from morning till evening suffers from headache for many years. So Nicolamet, sometimes such a Nicolamet along with Usnea barbeta, I alternate the medicine every 4 hourly. Within 3 days, patient feels better without allopathic medication. So very important is the in Bangalore city and also where so much of dust is there, like Delhi, asthma is a very common problem because of many reasons. It's because of pollens. In Bangalore, it is because of so much of pollution and also dampness. Or actually, I use good number of homeopathic medicines and also I prescribe some of the mother tinctures based on the physiological actions of the drug. It is a physiological dose, it's not a physiological dose, but patients will get a relief which is he feels comfortable because already patient is taking inhalers. So if you want to stop inhalers, we are forced to use some of the mother tinctures, and these mother tinctures can be used even as a mixture for inhalers also. I use often Lobelia inflata, where it is one of the vasomotor stimulant. It acts on the pneumogastric nerve. And also use Blata orientalis. Blata orientalis, everybody uses Blata orientalis because it's a medicine prepared from Indian cockroach. Indian cockroach has got so much of odor. Only medicine prepared from American cockroach, Blata orientalis, doesn't have much smell. And also is a medicine for bronchitis as well as wheezing. I use this as the mother tincture form also with minimum of 4 times a day, 30 drops with 5 spoons of water, 4 times a day, along with the regular homeopathic medications. Grindalia robusta is also medicines, is a mother tincture, acts on the pneumogastric nerve. It's a medicine for asthma. I use this medicine often. Sambucus mother tincture, it is generally a medicine for chronic asthma, elderly asthmatitis, where patients find difficulty in expiration. Yerba Santa Ectrodectin californicum. It is a specific medicine, acts as a bronchodilator. A specific bronchodilator. Adrenaline, note what actually it causes vasoconstriction followed by vasodilatation. I use adrenaline 3x as well mother tincture also use. And also use Bryonia alba mother tincture. When there's a stitching pain is there, difficulty in breathing is there, if there's a movement causes severe pain, note Bryonia 200 I give along with Bryonia mother tincture also will give with a good relief. So even I do nebulization in my clinic. For nebulization, note what actually for nebulization, they use only allopathic medication. But homeopathy also we can do nebulization, which I have successful in since many years. I use coca and Yerba Santa and coca and adrenaline mixtures I will make 10 drops with 20 drops of water in the nebulizer, and I give it for 10 minutes, 15 minutes, 2 times a day, 3 times a day. Patient really feel comfortable. And one more very important is the diabetes. No, diabetes is the India is the hub of diabetes, and Bangalore is the hub of diabetes. What we know, diabetes is caused because of many reasons. Not only main reason, notice one is the genetic. Number 2, it is a metabolic disorder. How to control the diabetes is more important here. If you don't control the diabetes, if the FBS is 200 and above, PPBS is more than 400, HbA1c is more than 8. First, we have to reduce the blood sugar level. Then only we can give the medicines. If you don't reduce the blood sugar level, it has got effect on the tissues and organs. And also it causes diabetic neuropathy, but everybody knows it. And the research what we have seen in homeopathy is also less when compared to allopathy, though it has got so much of side effects, but it reduces the blood sugar to some extent. It is. But I have seen actually a fluorescinum, a homeopathic medicine is there, a substance discovered from the fresh bark of apple, cherry, plum. It decreases the blood sugar level immediately. It should be prescribed in low potencies like 3x and 6x. Pancreatin, it's a sarcode. It decreases the blood glucose level. It's an extract of salivary gland as well as the pancreas. So even in my clinic, I use some of the therapeutic drugs like penicillin, cortisone, histamine, tetracycline. I prescribe cortisone, I prescribe histamine when a patient coming to clinic after taking under the cortisone medicine or under the antihistamine drugs. Instead of prescribing antihistamine like Allegra, other steroids, I prescribe homeopathic cortisone 200, histamine 200 along with the other medication which he needs it. The patient also feels better. And I have treated even penicillin 30 when there is severe infection is there. No doubt actually Parcel, Silesia, many drugs are there. I prescribe penicillin 30 along with Silesia I may prescribe. It gives the better relief in healing the inflammation. So I will go to the fever. Fever is once again a challenging. No doubt actually some of the symptom similarity will give the better results for fever. When there is outbreak of chikungunya, it has become a so in Karnataka, not only in Karnataka, all over India, chikungunya has become a pandemic. So that time actually patient was feeling severe body pain, joint pains were there, and uric acid levels were altered. No doubt actually homeopathy has got the medicines like Hepatorium perfolatum was there, Rustox was there. But in the book actually it is very clearly written, Polyphorus pinicola is a pine agaric. It's a medicine for bilious fever. It is specific medicine for chikungunya. I used to prescribe Polyphorus pinicola 200 into GID for 7 days. I used to prescribe and the patient used to feel better. So dengue fever is once again a challenging. If the dengue fever, if the RBC level, platelet count decreases below 20,000 and the patient is advised to go for ICU, we generally get a fear because patients say, sir, shall we admit the patient for ICU? Already it is advised. So we can treat confidently with the homeopathic medicines like Rotella sardis. It's a medicine for septic fevers, disorganizes the blood, and also it reduces the platelet count. We have treated good number of cases in our clinic, and also one more medicine is a chionanthus. It's a liver remedy, helps to increase the platelet count. We use chionanthus. Benzene, the benzol, it decreases the red blood cells and increases the white cells. See, a patient coming to clinic often suffering from fever and common cold, where the WBC is 18,000 or 21,000. If the allopathy doctors see this report of 21,000, they will think in a different angle and advise a patient to go for many other tests. But I have seen by giving benzene 30 for 5 days, WBC count from 21,000, it will come to 11,000. I have treated hundreds of cases. And Austonia scolaris, this is almost a specific medicine for fever which we use in the clinic. It is a medicine for all types of exhaustive fever. When the patient is not responding with any of the other regular medicines, we prescribe Austonia scolaris as the medicine. The medicine prescribed, prepared from data bar is one more as like a specific activities. Patient often come into clinic with recurrent abscess in the body. Few patients will get recurrent abscess in the body. And also, he has taken plenty of allopathic medication for ill effects of suppuration. And he has got some problems with suppuration, like because of taking so much of allopathic medication, he may have loss of appetite, loss of sleep. So by giving homeopathic proper medication, we give staphylococcin, is a medicine prepared from the Staphylococcus bacteria as an intercurrent remedy, which will help the patient to recover very soon. No doubt, actually, we have got medicines for suppuration like heparin is there, silicia is there, Vaxal is there, peonia is there, myristica is there, capsicum is there. But along with any of this medication, if we prescribe staphylococcin as an intercurrent medicine, it really helps. Patient coming to clinic, often throat infection. No doubt homeopathic doctors, everybody have saved good number of tonsillitis without going for operation. I think so. You'll agree. Everybody has stopped going to operation. When a patient is getting often throat infection because of many reasons, actually it is. No doubt, actually, we have got good medicines like I say, is lycopodium, Beratacar. Many medicines are there. So if we give streptococcin as an intercurrent medicine in throat infection, the infection will reduce drastically and the patient also feels better. And few patients will get axillary abscess. It is because of the sweat, infection of the sweat gland, they say. So instead of giving the antibiotics or the myristica or the silicia, later in lower potencies up to 200 potency, I prescribe 5 days at a time, give a gap of 15 days and prescribe. This will almost act as a specific and the patient feels better. Sanguinarium atricum. It is once again, it's a medicine for cold, and if there is a polyps in the nose, there actually Agraphis nutans were discussed for the adenoids in the nose. If there are polyps in the nose, we prescribe Sanguinarium atricum as a medicine with good. So ammonia causticum, it's a powerful cardiac stimulant. This is a medicine actually we have used when we are in the village. It's a medicine we can use even in the snake poison because it's a powerful cardiac stimulant. By doing proper first aid to the patient, remove the snake poison, by remove afterwards. If you prescribe before reaching the city, it may be a 40-50 kilometers. If you give ammonia causticum in 200 potency, often water doses are at least 15 minutes once, because the cardiac stimulant, patients will recover very soon. The next challenging problems, what we see is the skin conditions. The patient coming to clinic with severe itching all over the body. Severe itching all over the body. No doubt, actually, we have got good medicines like Rastax is there. We have got medicines like Attica urans is there. Apis mellifica is there. Belcamera is the medicine is there. And many medicines are there. It may be sepia or anything it is. But anthracocculi is a medicine when sepia meserium sulfur does not act. This anthracocculi is the medicine we specifically use during scabies. Because scabies, they say, because it's a parasite, allopathy doctors say apply something so that actually the parasite will die. What actually we do, we give internally, and the mother tincture is really given as an external application. It's a medicine used in the itching of scabies as well as local application in fungal infection also. Barat acetate. This is the medicine actually we give a chronic itching in old people. Chronic patient is having itching all over the body without any apparent cause. Without apparent cause, no doubt actually meserium is the medicine in the chronic itching in old people. But I have treated with barat acetate with curative of age with loss of memory with the good results. And also nowadays the baldness has started coming in early ages, not after 40 years. Only thing the history should be, there should not be family history of male pattern baldness. If there is so much of hair falling is there, we can prescribe Bacopa moniori mother tincture, Cantharis mother tincture. It should be given as an external application. 30 ml should be mixed with 100 ml of coconut oil. Every time while applying it, it should be shaked properly and it applied to the whole scalp, leaving the whole night and take the bath in the morning. So once again, the other problem what often we see is in the clinics is the hypertension. Hypertension, once again, patient themselves will not come to clinic because hypertension means we have to take allopathic medication. Nowadays, patient, because of so much of awareness and a lot of popularity among our doctors, because they have proved homeopathy is the medicine for all the problems. So I use, no doubt actually there are good number of medicines are there, along with a specific medicine actually, along with the medicine which suits for the patient, I give spartium scoparium, low potencies, or in the mother tincture form. It reduces the blood pressure instantly because it weakens the cardiac contraction, depresses the heart muscle. It should be prescribed in low potencies. I was, now these cases we are getting less actually, the tapeworm cases where I was practicing in the rural area. People who eat uncooked, properly not cooked meat, they used to suffer from tapeworm. Tapeworm used to think there is no medicine, homeopathy, and especially even for the parasites also, we are finding it very difficult to treat. What actually we think of Sina, Sabadilla, Natrum carb, like this, depending upon the patient's symptoms we prescribe. But I have treated good number of cases, and now also once in a while I get case. When I was in rural practice, I treated good number of cases. Felix Mass mother tincture is a male fern given in low potency. It should be given in empty stomach. Overnight fasting should be there with half a dram or the third potency with 2 ounces of milk. I have seen in 24 hours tapeworm is expelled, and we only think that once a tapeworm is expelled, not only tape you have to observe, you have to see the head of the tapeworm, so that actually is a guarantee it has expelled from the intestines. Now, tobacco chewing, tobacco smoking has become very common nowadays in younger generation, as well as many, it has become a fashion, or it is a fashion. So DYSFUNCTION indica, no doubt actually we have medicines like caladium sulfate is there, Naxomica is there, like good number of medicines are there. But some of the medicines which acts more specifically is only thing, unless we convince the patient, it becomes very difficult. We should accept that he must have the mind to stop smoking. Then only we can treat. If he challenges and if you give medicine, that will not help. That I know it. DYSFUNCTION indica, sweet scented purge, fresh bath. It takes away the craving for tobacco. No doubt actually caladium sulfate is there, Naxomica in higher potencies also we give. And effects of mineral water. See, I use Naxomica. I have not given the medicine. 100 years back, homeopathic books have written this. If you see the second paragraph, Naxomica in boric materia medica, that time it is not written. In India, we are using mineral water for the past 20 years. Now in 5 years, it has become everybody using mineral water. But 100 years back, it is written in boric materia medica, in second paragraph, effects of using mineral water. This is really a challenging activities, but it is helpful because of using mineral water for a longer time. Patients will have symptoms of gastrointestinal symptoms will become very common. They have constipation, which we have seen. With Naxomica, it will take care of the effects of mineral water. And nowadays it has become a fashion of drinking lassi or the buttermilk, sweetened buttermilk. And it has become so much of a habit. Some of the people, they drink 3 times a day. It has become a habit for them. But once again, it is written 100 years back in Medica, Elaps coralis, whole snake. You give this in 200 potency for 5 days, repeat every month. You see, after 3 months, there is no much craving for sweetened buttermilk. So toe walking, if it is a habit of toe walking, we can treat. But basically, it's a congenital idiopathic muscular dystrophy, where a child will walk on the toes, he will not keep the heel down. Allopathy, there is no medicine for it because it is the medicine actually, it will affect the anterior and lateral columns of the spinal cord. It causes the degeneration of the spinal cord. So homeopathic medicine like Lathyrus sativa in lower potencies, if you treat, gradually patient will increase within 2 years. So very commonly we see in the clinics where actually a girl is growing, but there is no development of mammary glands. Sabal cerulita is a medicine often used for the enlargement of prostate. But Sabal cerulita will help the girl when there is an underdeveloped breast is there. And everybody might be knowing actually when there is a Women with the large breast, we have got medicine like Chemophilia ambulate also is there. So varicose veins has become very common problems. So where actually, Vipara is a drug, MMNS is a drug, Naxomica is the drug, like that many medicines are there. But some of the specific medicines which we have treated is Mangifera indica, varicose veins with relaxed muscles and poor circulation, and also associated with respiratory problems and gastrointestinal problems. We treat with Mangifera indica in 300 and medium potencies like 200. Even in some of the pediatrics, we see chronic otitis media. There's a discharge always there from the ears, and it also affects the tympanic membrane also. You can see a small hole in the tympanic membrane. It is advised to go for the operation, or because of the hearing problem, the patient will be advised to go for hearing aid also. But we have treated good number of cases with capsicum 30 and 200, where chronic otitis media is reduced within 6 months, or maximum within 3 to 6 months it is. Simicifuga, simicifuga is used in medicine for joint pains where there is a difficulty in climbing the stairs. Simicifuga is a medicine, is a generally thought for the female complaints. It's a medicine once again used for tinnitus, and also one of the medicines we use often in the clinic is the calcareous silicata. Pioneer is once again a specific medicine we use in ulcers, abscess, and pustules in buttocks and around the anus. So nowadays it has become very common. Cholesterol levels have increased. No doubt, actually, American Society of Cholesterol has told not to use the medication, and they say it causes the side effects. Homeopathy, and everybody knows Indian diet itself has got garlic as garlic every day we eat in the Indian diet. And this garlic itself will help in reduction of cholesterol. If patients are using regularly garlic, it will reduce. But homeopathic medicine, Allium sativa, when there is a cholesterol level up to 350, we treat in the clinic. We give lower potencies for 7 days. Every month, alternate. At least within 1 year, all the cholesterol levels will become normal. Joint pains have become very common. Arthritis has become very common because of the inflammation. No doubt, we have got medicines like Respax, we got medicines like Gayakam, Valtheria, but nobody has thought like drugs like Valeriana. Valeriana causes inflammation of joints, but the modalities of Valeriana is similar to Respax only it is. We think when there is a suppuration is there, we think more of medicines like Silesia as the medicine, but gunpowder acts because it acts deeper than Silesia. Myristica, a specific medicine we use in Whitlow and other abscess, is a more deep acting when compared to Silesia. Patient coming to clinic with increased sleep, Atoxyl is a medicine we use. When there is a no sleep, we use Cataleria as the medicine. No doubt, actually, there are medicines. Cassifora is one of the medicine we use specific as medicine, but Cataleria in lower medicines, it acts better in decreased sleep. Enuresis in children, we have got good number of medicines. No doubt, actually, we got good number. It may be causticum, it may be some other medication, but along with the regular medication, we give Bacillum testinum as a single dose every 15 days repetition with the other medication. It helps in reducing the enuresis within maximum by 6 months or 1 year it is. So pimples is once again a very common problem. We see pimples have become, but other pimples we have got good number of medicine depending upon the constitution also. Whether it is in the puberty or after it is puberty, it will reduce by itself. After puberty, after 16 years, 17 years, we got good number of medicines. We treat according to the similarity, symptom similarity of the patient. But there are some condition where there is aggressive pimple, we call it as. It is like a abscess on the face, it is so much it is. It will remain for 15-20 days with a severe pain, pus will ooze out. No doubt, we think of Silesia, Pioneer, Myristica, but Copaiba officinalis, it acts more as a specific medicine. But it's no doubt, actually, Copaiba is once again a medicine for cystitis. Patient cannot urinate while standing position. The urine will fall drop by drop. And also is a specific medicine when there is a albuminuria. We can think of Copaiba also as a medicine. Very Now, the very common problem which we see in the clinics is the alcoholism. Our patient go to de-addiction centers. De-addiction centers also, they find it very difficult. But if the patient, there are many, how to convince the patient, how family cooperates plays an important role here. We are treating good number of cases in the clinic where only thing, patient should be convinced after at least 2 months, he like to leave the alcohol. That is very important. First, unless he is cooperative, it's very difficult. Stubborn patients also will get medicines. Gradually, it will reduce the craving for alcohol. Sterculia is a colonel, decreases craving of alcohol. Also, it's a medicine for decreased appetite in alcoholics. Acid itself is once again is stubborn patients I told, and also because of taking alcohol for more than many years, already tremors have started in the extremities, and also we see weakness, and patients is experiencing heart flushes. And we advise the patient, families, because acid itself look like a water only it is. That is why mix 20 drops every time he drinks water, or with the food only what he is eating. Just give for 2 months and see the results. Actually, he develops a aversion towards the alcohol. And one more specific medicine we use, the Curicus glandinum spiritus. It takes away the craving of alcohol. If there is a chronic alcoholic where there is a splenic, liver and splenic affections, we will give in our homeopathic medicines also. Angelica mother tincture, 10 drops, 3 times a day. If the dyspepsia or nervous headache is there, alcoholic headache is also very common problem. It takes away the craving of alcohol because it is a mother tincture. It's a physiological dose. We give the medicines for months together regularly. And also we prescribe Naxemica in high potencies like 10 mg to decrease the craving for alcohol. And now younger generation, those who are working in IT industries and too much of stress in the families, this has become a very common problem. Erectile dysfunctions is very common problem, not like 30 years back. And if you ask any patient, actually will say, how many days once you have, once you meet your wife, you say weekly once. I'm saying a boy with 25 years, I'm saying there is no interest because there is erectile dysfunction is there. And he says, I cannot perform the act. See, these are the medicines actually, these are the physiological doses actually. Damiana, Lycopodium clavatum, Agnus castus, everybody knows it is aphrodisiac. Acid phosphorus, acid phos, when there is so much of lassitude, weakness will be there. Hemvinum is once again, it is a specific medicine, it's aphrodisiac. Caladium sanguinum, selenium, where there is a dropping of saliva also will be there. Nufolutium. Generally, what actually I do, if there is so much of weakness will be there, younger patients say, mix Damiana, Lycopodium, Agnus castus, 30 drops with 5 spoons of water 3 times a day. This patient will get result within 1 month, maximum 2 months. Because nowadays Viagra has become very common. If you go to a chemist and ask if you want Viagra, Panagra, it will available for 20 rupees and the results will get within 3 hours. But actually, it has got its own side effects. It increases the hypertension and all. So kidney stones, nowadays it has become very common because of drinking tubal water. Tubal water contains too much of minerals in it. Because of it contains minerals and salt in it, we have seen good number of renal stone problems are there. In the renal stone, if it is in the calyx, ureter, bladder, we can treat. If it is the kidney, if it is a calcium axillary stones, where our treatment is 100%. If the Stagan stone in the kidney, I don't treat because it will not come out. It causes so much of pain. It needs laser treatment. So I make a combination of Berberis vulgaris, Pereira rubra, Sarsaparilla, Epigia repens, Osimum can, Hydrangea. It's a combination of mother tincture I prescribe, and I have treated thousands of cases with good results. Some patients have responded. The kidney stones have removed within 12 hours, 24 hours, within maximum 20 days, 30 days, which will reduce. When there is a, depending upon the pain, also give medicines like Colosynthus I prescribe, Magnesia fast also I prescribe, depending upon the pain I prescribe. But these mother tinctures, I have successful in treating the kidney stones. Thank you very much for the patient hearing.